Good morning. Exciting day. We don't get to have babies in the office every day, but when we do, we know it's going to be a good day. And if they cry, that's okay too. That doesn't have any reflection on any policy. It's probably because they're hungry or tired, but we are excited to be here today, and I'm honored to be with Secretary Putnam, Secretary Mallory, Dr. Kay Chandler, our legislators, and so many others who are dedicated to improving maternal health here in the state of Arkansas. We are all here to make a major announcement affecting all women, including new and expecting mothers in our state. As a mom, and the first mom to serve as Arkansas's governor, this issue is deeply personal. I know how difficult it can be to juggle work, childcare, and a pregnancy. I actually named my first child after Scarlett O'Hara, which I learned after 2 days in labor at the hospital was probably not a good idea because I was setting her up for a lifetime of stubbornness. But in all seriousness, my kids are the joy of my life. And any woman who tells you she enjoyed childbirth is probably lying to you. But despite what some in the media might say, one of my administration's top priorities is helping Arkansas women have the healthiest pregnancies possible. That is a critical issue in our state. We know the reality of this challenge. Arkansas has the highest maternal death rate in the nation. And beyond that, many women struggle with health issues during and after their pregnancy. Of the 35,000 pregnancies in Arkansas each year, 10,000 women wait until after their first trimester to even see a doctor. 1,100 women never see a doctor until they are in labor. That's an education problem, not a coverage problem. Healthier moms mean healthier babies. If women aren't in contact with a healthcare provider through the duration of their pregnancy and in the months after, they are at greater risk for complications. Some have suggested that the solution to this problem is to create a redundant program by expanding Medicaid. It would make for a good headline, but it doesn't actually solve the issue. That's because Arkansas already has resources for pregnant women through all 9 months of pregnancy and beyond. We provide maternal and prenatal care with zero out-of-pocket expenses through 70 health units around the state. We've expanded services available to pregnant women, making up to 214% of the federal poverty line. Arkansas has eliminated the benefit limits for pregnant women and raised the number of women eligible for complete coverage. And Medicaid already pays for 19,000 births each year, more than half of the births in the state. The solution is not more government programs. The solution is getting women to take advantage of the programs that we already have. And today, I'm proud to announce an executive order that I will sign here in a few minutes. The agencies and groups represented by the individuals up here with me today, ADH, DHS, the Surgeon General's office, and a number of other stakeholders will develop a comprehensive statewide strategic maternal health plan. This plan will focus on 4 points: improving education, improving healthcare access, improving coordination, and overall improving maternal health. Additionally, our state agencies will take immediate steps to enroll all eligible women in the programs that we already have that are available. Too many women simply don't know about the resources we offer. This is a major step towards fixing that. We'll develop an advertising and education campaign and explore grant opportunities and partnerships to foster maternal health improvements. We will also create a pilot program targeted at 5 counties with low rates of prenatal care, laser focused on connecting women to available resources. The next speakers will expand on each of these points, but I want to make my administration's priority clear. We are pro-life, we are pro-woman, we are pro-mom. Gimmicky headline-grabbing policies will not fix the problems that are facing Arkansas women. It will take a coordinated approach between public, private, and nonprofit sectors to address this issue. I'm proud to stand up here today to announce such an approach. I'll now invite Secretary Putnam and a few others to give some additional details, and then I'll be happy to take a few questions before we sign the executive order. Thank you for being here. Thank you for your commitment to improving maternal health and overall women's health here in the state of Arkansas. Thank you.
Thank you, Governor. Good morning. I'm grateful to Governor Sanders for choosing to highlight the issue of maternal health in a bigger way by challenging all of us to focus on the larger issue of women's health and prenatal care. We need the entire state of Arkansas to be knowledgeable about care, coverage, and pregnancy services available to women, regardless of where they start their pregnancy journeys. I'm the proud mama of 3 amazing daughters, and I started my journey in 3 very different places. The executive order the governor signs today will establish the Arkansas Strategic Committee for Maternal Health, and we will engage with legislators, advocacy organizations, healthcare providers, and other stakeholders to provide input and support in the development of a statewide strategic maternal health plan. So that means all y'all. The Strategic Committee has been asked to serve because we all have the ability to remove barriers and change policies that may be impeding access to care and coverage. But it is going to take this broad stakeholder group and beyond, bringing together many different perspectives on women's and maternal health to inform how we as a state can prioritize and act to ensure that no woman goes without care before, during, or after pregnancy. I think we're the only state in the country with a governor who is charging us to work together as a state, a whole state, to make sure that we have healthier women who go on to be healthier moms with healthier babies. Working together, I expect that we can begin to move the needle and bring the spotlight on Arkansas for its success in healthy outcomes for pregnant women and their babies. With this executive order the governor is signing, we are taking action immediately on a number of items to improve maternal health. This includes taking immediate steps, as the governor mentioned, to enroll pregnant and postpartum women in Arkansas with available health coverage options, streamlining coverage transition processes, and eliminating any gaps in care that we identify. Reprioritizing existing resources to develop a multi-agency maternal health education and advertising campaign, and exploring opportunities to foster maternal health innovations and improvements, including, but not limited to, applying for grants, public-private partnerships, and making changes to the Medicaid program. Of the approximately 36,000 women who give birth each year in Arkansas, slightly more than half, or about 19,000, receive their health care coverage through Medicaid. Pregnant women are covered up to a minimum of up to 60 days postpartum and may continue receiving Medicaid coverage beyond that time period as long as they qualify in one of Arkansas's Medicaid categories. The discussion around providing 12 months of postpartum coverage has been a national talking point. It's true. For Arkansas, however, we do provide access to health care coverage beyond that 60-day postpartum period. What we don't do, and what this executive order will help change, is ensure that women and their families are aware of their options before that 60-day period ends. We need to make sure to connect them to continuous coverage that is available either through regular Medicaid, expanded Medicaid through Our Home, or if their income has increased, through a low-cost subsidized health plan on the federal health care marketplace. The easy thing to do would be to simply say yes to adding an additional 10 months to the end of the 60-day postpartum period and check the box. To date, we have not identified any true gaps in coverage, so adding this would simply be duplicative and not the best use of resources. But we also know that simply providing coverage, if that coverage is not being used, does not make anyone healthier. I'm excited to be here today among many women, including the governor and all the babies, who are leading this charge that women in Arkansas should have healthier pregnancies and healthier babies. Thank you.
Thank you. I'm excited to be here with Governor Sanders, Secretary Putnam, Dr. Chandler, Dr. Greenfield, and many others in the healthcare community to discuss the governor's plans to improve women's health in Arkansas. And before I start my official remarks, I would be remiss if I didn't say I'm the proud mother of one daughter. So, as has been previously stated, our state's maternal mortality rate is high. But from information gathered through thorough reviews of maternal death records, we know a majority of these women had cardiovascular conditions, cardiomyopathy, and hypertensive disorders of pregnancy. What this tells us is that these women had health issues before and during pregnancy. We know the battle against chronic disease issues is tough, and results does not come quickly. But what we can work on in the fight for better maternal outcomes is helping women get the earliest and best prenatal care possible. And that's why we're here today. We need to focus on women's overall health, not just for the 9 months of their pregnancy. This executive order signed today by the governor will immediately enact a number of options that will improve women's health overall and access to care, including the creation of a pilot program targeting 5 counties with low rates of prenatal care designed to increase the percentage of women who access prenatal care in the first trimester and reduce incidences of women who receive no prenatal care prior to delivery. ADH currently provides prenatal and postnatal maternity services in designated counties throughout the state. These counties are where there are few or no maternity services available. We have looked at each of these counties in our 5 public health regions and identified the 1 county in each region with the highest rate of women who receive no prenatal care. These counties include Phillips, Crittenden, Scott, Garland, and Polk. In the next couple of weeks, the ADH team, along with the Surgeon General, will begin community meetings in each of these counties to share county-specific facts and data and begin a roadmap for local maternal success. We will start by pulling community resources and partners together and working together to identify maternal health champions. ADH staff will work with these partners and champions to identify gaps in services and collaborate on steps to close these gaps. Our ultimate goal would be to do this in each county where ADH provides maternity services. Thank you to the governor and all those here today. We're excited to get to work on these initiatives. Thank you.
Hello, I'm Dr. Kate Chandler, and I'll just add too, since we're talking about being moms, I'm proud mother of 4 children and the grandmother, or Bubbles, to 5 grandchildren. So there are 5, 4, 3, 2, 1 right now. So, but we are so pleased to be here today under the leadership of our governor, Governor Sanders, to address maternal health in our state. Maternal mortality is a national concern and has been increasing overall in the United States since the 1980s. Arkansas has seen this increase as well. And even with all the medical advancements throughout these years, we have not done better in this area. The loss of lives of our moms is a profound tragedy, and we must do better. All of us here realize and understand that. That's why we're here. In fact, that is why the governor called us here today. But not only do we want to prevent maternal mortality, but also prevent morbidity. And that's those cases where mom survives, but she comes into the hospital one way and leaves another way. Possibly she's had a stroke. Some of these complications to where, yes, she survives, but she's not the same and she's not functioning at her best. So that is why, again, the governor is focused on women's overall health, not just for the 9 months of pregnancy, not just for the 12 months after pregnancy. As the governor said, this executive order will establish the Arkansas Strategic Committee for Maternal Health, and we will engage with legislators, advocacy organizations, healthcare providers, and other stakeholders to provide input and support in the development of a statewide strategic maternal health plan. This order will also explore opportunities to foster maternal health innovations and improvements, including public-private partnerships and changes to the Medicaid program, and expand the use of evidence-based health care, treatment processes, and protocols for pregnant and postpartum women across Arkansas hospitals. Many of the maternal deaths we've seen are related to chronic diseases that have started and were present prior to pregnancy. Many of my obstetrician colleagues have expressed that the women they are taking care of are coming into pregnancy sicker and less healthy than they have in the past. We've definitely seen a difference there. And this puts them at greater risk of developing pregnancy-related complications. This is how we know that while we need to make sure that women are getting the best access to care and the best care possible during pregnancy, delivery, and postpartum period, we also know that we have to start earlier, even prior to pregnancy, so that women come into the pregnancy with optimal health. The key to maternal health in Arkansas is overall women's health, which is why this plan focuses on all aspects of maternal health. Just as our governor has placed a priority on improving education in our state, Overall, education will play a key role in improving health literacy in our state. In addition to optimizing utilization of current maternal health care initiatives and bringing new innovations that will help improve overall access and utilization of care, this order tasks us with raising awareness and educating our communities on the importance of women in the state seeking to be the best in health possible, their best health possible, even prior to pregnancy. So working together, we'll bring a bold and comprehensive approach to improve the health of women in our state that will translate into healthier pregnancies, healthier moms, and healthier babies. Working together, we will do better for our moms, for our babies, for our families and communities in our great state of Arkansas. Thank you.
Good morning. My name is Allie Barker, and I'm excited to be here today as a woman, as a former NICU nurse, and the mother of 4 children, 3 of which we adopted. Because of those things, I've really seen firsthand the importance of antenatal care, the impact of education about that care for women, and the support of the community for these soon-to-be moms and new moms, and of course, their newborn children. Specifically, in the life of our oldest son, it's hard not to wonder if his life might look a little bit different if his biological mother had had access and received appropriate prenatal and postnatal care prior to him being hospitalized at just 9 months old. There are a number of amazing resources and providers across our state, and it's unfortunate that most women, unfortunately, are just not aware of these resources that are available to them. And I'm proud to live in a state with a governor and a team who I know is going to fight every single day to make sure that these women have access to these resources to improve, of course, their individual health and the health of their newborn babies. I also understand the importance of consistent data monitoring and protocols, and I'm very excited today that the executive order is going to establish both in our state. I'm confident that the governor and her actions today will have a real, very measurable effect on maternal health outcomes in our state. And as a nurse and the president of the State Board of Nursing, I'm very much looking forward to working with our state agencies to implement this plan.
Again, I want to tell everyone thank you for being here and for being supportive of these efforts and helping us bring all of the stakeholders to the table so that Arkansas can not only address this problem, but we can lead our nation in how to fix it. So thank you for being here. And with that, I'll take a couple questions. And I am going to warn you ahead of time, I'm probably going to do that quickly because I think we are testing fate with a few of our visitors, and their moms' arms are very tired. So I will open it up, and if you guys have any questions, happy to take those now. That's a part of what this team that we are putting together through the executive order is going to work on, but we want them to get started immediately. They've already been working closely to put some of that messaging together. I think what you see here today, healthier women, healthier moms, healthier babies, those are the types of things we want to focus on. We don't want to just look at women during 12 months or 9 months of their life. We want to focus on the entirety of women's health, and I think by bringing all of these stakeholders together and really educating women, we're going to be able to do that.
So about the 12-month expansion, I think it's great that so many states have done it, including a number of red states and a number of Medicaid expansion states. So what makes Arkansas different, and why have other states seen this as an opportunity they should?
Yeah, so every state has a different setup and different coverage. Our healthcare system looks very different than all 49 other states. No 2 states have a similar setup, but Arkansas already offers that coverage 60 days postpartum, and then we want to make sure that we are transitioning women to coverage that already exists in the state. I don't believe creating a duplicative program just for the sake of creating a program is actually going to fix the issue. We already have so many women who aren't taking advantage of the coverage that exists. Creating more coverage doesn't get more women to the doctor. Having those women actually go and see their healthcare provider, that's what we have to focus on, and that's really what we're trying to do and the solution we're trying to put forward with this group.
So does Arkansas have coverage options that say these other states that have embraced it do not right now?
We do have coverage options that are available that would cover women certainly up to that 12-month period. One of the other things that I think is a big point of confusion is that even if you expanded that coverage at the end of 12 months, you're still having to transition those women to another type of coverage. We're just trying to do that sooner so you're not having to do it multiple times.
I just saw your letter on the budget for here. There's 1.6% increase in April. Is there anything enough?
It is, and that's been, the goal of this administration. When I ran for office, I was very public about the fact that we are going to work closely, and I'm very proud of our cabinet and how well they have done in helping us tighten our belt. And government growth has to be slowed. If we want to continue to do things like phase out the state income tax, then we have to stop the growth of government. And on average, that is about 3%. I'm proud of the fact that our budget is 1.76% growth this year, while still being able to aggressively invest in the key priorities of this administration, like education, like public safety, our parks, and our rural areas. So I'm really proud not only of our ability to focus on these key priorities that I know are going to change the state, but to do so without exponentially growing government is a big win for Arkansas.
I know you mentioned changes in Medicaid or Medicare with this program. Can you explain what you mean by that?
I'm sorry, I'm not following the question.
What have you mentioned that through this committee, the new changes implemented maybe how the state handles Medicare? Can you explain what you meant by that?
On this specific group that we're establishing through the executive order, they're going to look at every option on the table. So one of the things that already exists, the Maternal Mortality Committee, and they're going to be working in close partnership with that group. That group largely helps gather data and research, and this group that we are establishing through the executive order will be focused on the implementation side. And so it'll be a great partnership. We've got Dr. Greenfield, who's been part of that committee, and they're going to look at all options on the table, but specifically focusing on those 4 priority areas that I laid out.
Well, for the legislative report for the Maternal Mortality Committee, for the past, I think, 2 years, they've been recommending to extend it to 12 months. Were they just unaware of the other coverage options as well?
That's a question you'd have to ask them. I'm not specifically part of the committee. I do know that coverage exists. We want to make sure every woman has coverage, and that is currently available in Arkansas. But again, coverage does not equal health care. We have to make sure that these women are actually going and seeing a doctor. When we have 1,100 women in the state of Arkansas that are not seeing a doctor, that until they go into labor and give birth, that's a problem. And that's something that we can address, and something I know collectively we can do a better job on. I think one of the things that I would be remiss, and we'll wrap here, is that if you don't take a second to look around this room and see the variety of people represented, this is a collective effort. We have people from the public sector, the private sector, the nonprofit sector, all coming together saying this is a priority, we will work together and we will fix it. That is a big deal for the state of Arkansas. It's something that we haven't seen in the past, and I'm really proud of the fact that we have stakeholders that normally don't always work together that are represented here in this room. I think it shows the level of commitment, but I think it also shows that we're going to get the job done. So thank you for being here today. Thank you again for those who are working so closely on this issue. I know Arkansas can change our trajectory, and certainly we can do a better job taking care of our moms. Thank y'all so much.